Hey, I'm Sophie Rees. I'm a researcher at the University of Bristol. Can you all see me? I'm too short. Yeah, we're talking about our project, which was co-producing an online information guide for people with vulval lichen sclerosus. Yeah, it was a big collaboration across lots of institutions and with some really fantastic patient representatives as well, who were a big part of it. Oh, I'm going to hand over to Roz. Sorry.
Thank you. My name's Rosalind Simpson. I'm a dermatology consultant in Nottingham, and I'm very proud to have been part of this team, which was led by Sophie, to develop the LS Guide. Let's start with some audience participation. In the audience today, has anybody heard of lichen sclerosus? Can you pop your hands up if you have? That's a reasonable number, actually. I'm impressed. So, lichen sclerosus, or LS for short, is a chronic long-term skin condition that predominantly affects genital skin. And it is most commonly affecting the vulval area, although it does also affect men and children too. It's believed to affect around 1 in 100 women, even though we don't have really good grasp on the numbers of people affected. But often, people don't know much about LS, even healthcare professionals. And that is a problem because it leaves patients struggling to get a diagnosis. Often misdiagnosis occurs and people have multiple visits to different health professionals, but ongoing symptoms and suffering. It delays proper treatment for the condition. And then when people are diagnosed, they find that they have little information, little high-quality information about their condition. And people suffer in silence because it's a hidden disease. Okay? Next slide. So LS, due to the inflammation, causes itching of the skin, which can lead to cuts due to skin fragility, which is painful. And this itching and discomfort has an effect on day-to-day life, as you might imagine. But it's more than just an itchy skin condition, because LS can lead to scarring of the genital area, which leads to difficulty on impact on day-to-day function, but not just going to the toilet, but also on relationships and sex. But in addition, there is a risk of cancer in people who have this condition if it's not treated properly and it's neglected. And so this is why we have created the LS Guide, to really try and empower patients and health professionals to know more about this condition. So I'll pass back over to Sophie. Thank you.
Thanks, Roz. Okay, so I led some research, mixed methods, so I used qualitative and quantitative methods to understand the lived experience of lichen sclerosus, of vulval lichen sclerosus. And two of the key things that came out of that was that people were talking about having missed opportunities for diagnosis, so they were going and seeing their doctor over and over again and not getting diagnosed, getting misdiagnosed as things like thrush, or it's just the menopause, things like that. And also missed opportunities for education. They weren't even told sometimes that it was a chronic condition, that it was something they had to live with. So we were really hearing these stories over and over again and recognizing that people just weren't getting the right information. So there was a need for really good information and tools for patients. So from that research, we assembled a fantastic group of dermatologists. We're all up there. Dermatologists, I'm a researcher, and then we had patient representatives as well. We got some funding, which I'll tell you about in a minute, but we did a survey of a really big online Facebook group, support group, to understand which topics people thought were the most important. And then we once we had a list of topics, we assigned a patient and a health professional to every topic. So every topic was co-produced. All of the text was written by both a patient and a health professional. And we created a huge website it ended up being a lot bigger than we perhaps initially imagined, with loads and loads of information, practical tips based on evidence that's kind of scientific evidence, traditional evidence, but also patient knowledge and understanding and experience. And that was really important, that it had both of those things to make it really valid and useful for patients. So we also created animated videos, which I'll tell you about in a second. And we launched in January of this year. So this is the front page of the LS Guide. You can use the QR code to find it if you like. It's a really, like I say, it's a really big online resource. It works on mobile, desktop and everything. And it has embedded videos and lots of information. And this, I'm hoping, will work.
Living with vulval lichen sclerosus, or LS, isn't always easy, especially when flare-ups make you feel uncomfortable, upset, or isolated. That's why we've built a brand new guide full of straight-talking advice and bite-sized videos on everything from what LS is to how to soothe your symptoms and get the support you need. Find us today at lichensclerosisguide.org.uk.
Yeah, so we do have videos that you can go and watch. And these are the 4 videos, which actually could be useful for anybody, especially the vulval anatomy and how to do self-checks. It could be useful for anybody. And then we have a really detailed video on how to put treatment on, and also one explaining what lichen sclerosus is, because we found that people really weren't understanding what their condition was. We also have some tools and resources. So we have a treatment template plan. So this is really useful for health professionals who look after these patients, to sit down with them and explain exactly. So we have an anatomical diagram, because they can explain exactly where to apply their treatment, how much to apply, how much steroid ointment to apply, and things like that. We're getting lots of really great feedback about that from health professionals. And we also made a checklist so that for people who think they might have LS, they can use our checklist, take that in to the doctors with them, and hopefully get diagnosed faster. And so then we've had lots of success. So it's actually gone up, I checked yesterday, and it's about 160,000 views on the website. We got a feedback survey, and people are saying that it's helping them to feel more confident managing their condition, which is just brilliant to hear. And there's a quote there from a patient who says, "I came across this website by chance, and it's taken away the fear. My mind now says I can deal with it." So it's really, really fantastic to hear that we're having such a positive impact in patients' lives. And we've been doing a lot of work promoting it. So we've been to lots of health professional conferences, raising awareness of it, trying to get it into clinical practice, because we want it to be signposted to patients. Our fantastic patient representatives have been really, really involved in this. So we have Zoe here today, who's with us, and we also have Claire, who can't be here today, but she's been shortlisted for one of the categories this afternoon. And she has been doing a lot of promotion. She went on That Time of the Month on Radio 5 Live, so she's doing lots and lots of work to raise awareness of it and constantly getting it into people's knowledge. And we've set up a portal so that clinics can order our materials to go to their NHS clinics to give out the template treatment plans and things like that. So we're getting it into clinical practice. So next steps are just to do some more work on it, make it even better, and to evaluate it, because we think this could be a really useful tool going forward. And we would like to thank our funders, so the Wellbeing of Women, the British Society for the Study of Vulval Disease, and the British Association of Dermatologists, the institutions we've worked with and collaborated with, and our amazing patients. Thank you.
Okie dokie. Questions? Excellent. Question here.
Thanks for that, ladies. I just wanted to ask about the resources that were available for people to request from NHS trusts. Are they available in alternative formats as well?
That's a really, really great point. Thank you so much. So this is something we're working on, is making it more accessible. But that's a really good point. We don't have the treatment template plan in other formats at the moment, but maybe we could have a conversation afterwards. It's something we're working towards with the next, hopefully, bit of funding that we can get to improve it even more. Thank you.
Any more questions?
Lovely to meet you. I actually judged that category and chose you as the winners.
Thank you.
I had it in my phone. What I'd like to see, though, is more representation, because all the pictures that I saw up there were of white people. I'm sure it's probably some of your community volunteers, champions. You need to start recruiting, because this is not a disease which only affects white people, black people as well. It is an intimate subject area, but you need to make sure you recruit white, black, African, and Caribbean people going forward. Thank you.
Thank you. Shall I just say? Just to say that we do have Neelam here at Shergill, who's part of our group, but we do recognise that, yeah, we are not a very diverse group, but yeah, thank you.
Okay. Any more questions? I think you've stunned them into silence.
Thank you very much.
Thank you very much indeed.